it's become very complicated.
Okay, well, go ahead, Jane.
Well, I was just going to say, I think as well, when we talk about acute care, we have to understand exactly what that means. And there may be definitions in the Health Care Act and so on. But in fact, if we take something as simple as surgery, surgery exists within a continuum. So for a patient who is facing surgery, it isn't simply what happens in the OR that is important. It is what happens before the OR, the preparation, and it's what happens afterwards. So that if you have something like outpatient rehab, that's part of a continuity of care. One can't simply operate on a person and then abandon them, And physio is extremely important to a successful outcome of surgery. So it's part of that continuum.
Well, I'm going to ask you, Frank, what the difference would be between this organization, this group, Citizens for Alternative Solutions, and the other local groups that are out there, whether it be the Citizens Health Coalition or the other groups that are operating in the area. Is there anything that defines you, this group particularly, makes you different from that group?
I don't wish to drive a wedge between our group and the other one.
This is just to clarify for some, because a lot of people are saying, well, why would these people be an offshoot, or is this the same group and there's just a different three people? Does this dragon have three heads, or is this a different group, and what makes it different?
Fundamentally, what we are saying is we accept that we all must be fiscally responsible, and if there are no new monies coming in, we have to try to balance the budget through some other methods. Okay, that's one thing. The other thing is that in attempting to balance budgets, we also accept that certain patients may be better served at some other facilities other than in the hospital, okay, like the alternative level care patients and so on that are not meant to be housed in an acute care facility. We accept that as well. But as Bridget pointed out, there are concerns that we have. We want to make sure that the outpatients rehab, for example, is retained. We're concerned about moving the diabetes educational services out of the hospital if we don't find equivalent level of services within the community. And our understanding today is that that is the case. No one else within the community could offer the same level of service that we have right now at the hospital. So to retain these patient services, what we would like to do is go back, work with the board and see if there are any other opportunities of squeezing the present structure of management and administration, just to squeeze out adequate funds for us to be able to retain these services at the hospital. On the diabetes situation, we recognize that it could be, this educational service could be offered anywhere. It doesn't have to be in a hospital, but it has to be offered by well-qualified people.
Well, the argument I know by the board and by the CEO is that there is currently a facility in Port Hope, the Port Hope Community Health Center, which does offer a similar, if not the same, service for diabetes.
It's not quite the same.
It's not up to par.
It's not the same.
Okay.
That's really our issue. Sorry.
Well, is there motivation on the part of that operation in Port Hope then to upgrade, to become the service that is being provided in the hospital?
I'm sure the motivation is there because it is understandable that to have two such areas within the community offering similar services, not the same, but similar, can easily be perceived as not being efficient. But at the moment, it is premature to consider that Port Hope Clinic could offer the same service that is being offered at our hospital. So It's putting the cart before the horse, which is the problem, see.
So if I may, then the fundamental difference between the various groups then is that this Citizens for Alternative Solutions is actually that, offering alternative solutions. It's not saying, I have a problem. It's saying, I have a problem, but this is a solution we'd like to look at, right? And it's the same thing, you know, and as a manager in business, you know, I mean, whenever an employee came to you, you didn't want to hear the problem, you want to know what the solution is going to be. And that's really the difference between the role that you've taken on and the role of, say, the other organization. Although we haven't had them on the show yet to outline what their position is. But
I wanted to say, Dave, if one has the opportunity to speak to some of the doctors, they'll tell you that diabetes is one of the biggest killers today, and that by having these qualified, experienced ladies who specialize in diabetes, the nurses in the hospital now, it takes a lot of pressure away from them. It allows them to concentrate on other things, and it also is an asset to have them there so they can take over it. That's something that is very important that they really have to look at. And if they do have the location to go to and they're going to have equal, then that's fine as far as that avenue. But when we look at the changes they want to make in diabetes, chronic care, long-term, and let's take long-term. Long-term, if they can, again, find the spot, makes a lot of sense because it's less chance for a patient to pick up a virus or a disease, and it's mainly elderly people. So there's a lot of logic to what they say there, but with all of these changes that they want to have, they've got to make sure they've got these in place. Okay, so far they haven't got anything in place. So my argument is that we only are looking at one avenue right now, diabetes. So why are you scaring everybody with all these changes when they could be 6 months, a year, or two down the road? And we think that we can come up with some creative ways of preventing this, then why are they still going ahead with it? It doesn't make sense.
it doesn't seem to me as though, at least from a media standpoint, it doesn't seem to me there's a great willingness on the part of the board to listen to alternative solutions. It seems to me as though they've got the position that they've looked at everything. They've done all the number crunching that they can do. And from their position, these are the things that need to go. Now, to respond to long-term care beds, I mean, we know there is nowhere to put those people right now. We're talking probably 6 to 8 months before any of those people, unless they decide to set up portables in the parking lot of the hospital, which, you know, is insane. I can't even see that. As far as the physiotherapy goes, again, it's needed. It's a requirement for post-operative care. If you don't get it, there's a real good chance that something will happen that will affect your healthy outcome, and you'll end up back in the hospital.
Right.
So they've got to make sure that they've got that covered. As far as the diabetics clinic is concerned, again, as you pointed out, number one, you know, it's right up there, if not the number one killer in Canada. It's up there in the top 3 anyway. So these are facilities that are required. So they can talk about how they're going to be closing them down, but in the immediate, you know, I can't see them doing it. I can't see them orphaning those. I mean, we're talking about orphaned patients at that point. We're talking about long-term care beds, and even the county. I talked to Peter Delante on the last program about that, and he raised the issue of the other facilities that are run by the county already taxed with waiting lists. So the alternative really isn't there right now, unless the county's talking about building a long-term care facility, at which point they're going to have to go to the province for the money for that. So really the province has to look at where they're going to spend the money. In the long run, they're going to be spending money, whether it's in building a new facility for long-term care or building another addition on the hospital to do what you're talking about in terms of creating a doctor's facility.
And even the beds that they're going to close are going to stay there. So that's another avenue that the committee could look at in raising money. You know, there's got to be different ways that we can utilize that. So as I say, not everything is lost.
Go ahead, Frank.
If I may add, one difference that I perceive in coming from the private sector and sort of looking at public sector is